More than 140,000 Idahoans contracted COVID within that first year of the pandemic.
Wow.
And if that was the only time they came down with it, you probably think, oh, they must be long over it by now. Well, new research shows a COVID infection can lead to a higher risk of heart and lung complications a year later.
Yeah, these people are referred to as long haulers.
Right.
It's called long COVID. And as our Andrew Bartline learned, local hospitals are seeing these same results right here in Idaho.
It's often called long COVID, where patients dealing with symptoms long after their initial infection. At the St. Luke's COVID Recovery Clinic, they say they're seeing symptoms that bring on a whole new wave of health risks.
A patient's fight against COVID can be more than just beating the initial infection.
There are a lot of things that are different.
A study from the peer-reviewed medical journal Nature Medicine analyzed more than 150,000 patients and compared them with two COVID-free control groups. The study concluded, quote, "Our results provide evidence that the risk and one-year burden of cardiovascular disease in survivors of acute COVID-19 are substantial." St. Luke's medical director, Dr. Laura McGeorge, confirms these findings from her own firsthand experience.
Our COVID recovery clinic is really just a tip of the iceberg.
St. Luke's has a referral-based clinic that follows up with COVID patients after initial infection. McGeorge reports seeing irregularly fast heart rates, irregular heart rhythms, heart failure, strokes, and blood clotting.
By the time they make it to our clinic, they often also have other manifestations of long COVID, which really includes depression, anxiety, increased shortness of breath, inability to exercise.
McGeorge says after fighting off a severe infection, like a bad flu, it's not abnormal to experience lingering symptoms. It's called chronic fatigue syndrome. But McGeorge says COVID patients are fighting off these problems at a much higher rate. And COVID's prolonged health problems are more severe than other viruses and different.
The clotting, we have not historically seen that increased risk of clotting with other viruses.
Blood clots are a high concern for McGeorge. She says blood clots can lead to a stroke or partial paralysis from the spinal cord not getting enough blood.
When you clot off blood vessels, you can have all sorts of manifestations from that.
The Nature Medicine study shows the more severe a patient's COVID infection, the more susceptible they are to heart complications down the road. But McGeorge adds preventative measures are the best defense because St. Luke's COVID Recovery Clinic is treating patients who fought off mild infections.
It's becoming increasingly clear that this virus in some version is going to be here with us. I think the best thing is to postpone getting it as long as you can.
St. Luke's doesn't have exact numbers or percentages for us on the likelihood that a patient could develop long COVID, but they pointed us toward a national study that shows 50% of hospitalized COVID patients will develop one long-term COVID symptom. Reporting from downtown Boise, outside St. Luke's, Andrew Bartline, Idaho's News Channel 7.